I want to thank everybody who's here for our meeting on TruDOSE regenerative therapy. We have the mad scientist himself and developer of the program, Tapley Holland, with us, who's going to educate everybody on this technology. Uh, as most of my patients who I've spoken to about this, they're very familiar with regenerative medicine. They're very familiar with platelet-rich plasma, but they're only familiar with it in the context of orthopedic medicine. And then my eyes have been opened and I've seen the light as a result of Tapley's work of using this technology not only for orthopedic problems, but for a myriad of other health conditions. Tapley was gracious enough to give us his time to do a presentation and answer questions that people may have. I want to thank you, Tapley, for doing this for us. We look forward to bringing this program into the clinic. We do have a start date of October 4th, which is a Friday. So those of you who are interested in pursuing these types of treatments, once you get better acquainted with conceptually with what we're doing here, you're more than welcome to call the clinic and set up the appointment. Everybody knows the phone number, 954-473-8925, and feel free to give us a call. The website's www.drscottdenny.com. We're very hard to find. Tapley, would you like to get started?
Sure. For anybody who has any questions, just put them in the comments, please. If you don't, since you're a first-time Zoomer, just click down there at the bottom and you'll see something that says, well, it usually says chat.
Yeah, there's a chat thing there.
So it says chat, just type your question and we'll get to them. And so the purpose, and if you've seen these Zoom calls on the web before, please kind of shake your head so I know. And I apologize that some of this is kind of repeat information for you, but people like listening to these over and over. So, and I love doing them. And the purpose of this call is to do just that, just to give you information. And I'm going to share my screen, and then I'll go through my little talk for about 25 minutes, and then we'll open it up to questions for everything, because the reason that we're on this call, can you see the screen?
Yes.
Is due to a therapy that I uncovered, and it's the result of a technology that I created. And the title of this talk is Reversing Systemic Inflammation with TruDOSE. Now, this is a talk that I've given to many doctor conferences. I've given it to the Autism Health Summit. I'll be giving it again here to a few conferences coming up this fall. Lyme Bites, Doctor Talks. So it's one of those things where it's kind of making the round. So I got to come up with some new material. And as a disclosure, I did create the technology and the therapy. And these are all the sources of the literature that I'm going to be discussing tonight, or at least I can reference. So if anybody wants to kind of fact check my work, but this is what we're going to be talking about. What is platelet-rich plasma? How do we create it? And really not platelet-rich plasma, but any of stem cell therapies in general. And why these therapies, all of these therapies, have a 50-50 success rate, meaning it's worked for you before, but it doesn't work now, or it worked for your friend, but it didn't work for you. And how that problem of that inconsistency led to me creating the TruDOSE technology, and how that technology ultimately led to me uncovering the IV therapy, which is undoubtedly why everybody is on this call. And to talk about that therapy, you have to understand what we were not taught about what our platelets are doing inside of our body. And then ultimately, we'll wrap this up by talking how this is actually reversing these inflammatory conditions. So when you talk about platelet-rich plasma, many of you have had it. This is nothing new. It's a therapy that's derived from your own blood, and it's described scientifically in the literature as a therapy of delivering a concentration of platelets over that of your baseline platelet count. Now, this definition could apply to stem cells, umbilical cord stem cells, but we're talking just about platelet-rich plasma. And there's over 30 years of data, I would, in thousands of articles that I would arguably say that this is the most widely studied therapeutic that exists within the medical domain. It's literally across every specialty you can think of an application, but we've primarily become to know it as, like Dr. Denny was saying, for site-specific injections, meaning make my knee feel better. It got its start in dental applications, wound care applications, and many of you probably had it done on your face or definitely made your hair grow down at the med spa. And like I said, it's only known to be site-specific. So how do we create it? Well, we take a volume of blood, and this is how you create really any stem cell therapy. But again, we're sticking with blood. So you take a volume of blood from your arm and you process it in a centrifuge, and the cellular fractions separate based on their weight. So red blood cells fall to the bottom, and you have everything else that kind of rises to the top. And you take this everything else that rises to the top, and you move it over here to process it again, and then centrifuge it again, and then the next heaviest thing will fall to the bottom, which in this case will be your platelets. And so there you have it. There's your concentrated platelets. So really, centrifugation is really more of a filtration process to get out the one specific thing that you need. So think of it like orange juice pulp, and you have no water to it, so it's highly concentrated. And you add a little bit of water to it, it becomes diluted. And the more water you add to it, the more diluted it gets. Well, in the context of platelet-rich plasma, again, I said that there's thousands of articles that have written on its application and efficacy, but it's largely considered about a 50-50 success rate. You can find literature that overwhelmingly supports, let's say, for osteoarthritis of the knee. And you can also find literature that supports that PRP does not work against saline control. And why is that? It's because we've never really talked about, understood, described, scientifically identified the dose response relationship to any of these therapies. It's as simple as that. And it's a counterintuitive concept because the idea of dosing makes complete sense for medications, but in the world of say regenerative medicine, it's never really made sense. So I kind of put my finger directly on that problem because I got to see over 20 years the inconsistency and variability that exists between patients to patients, and I also saw my fair share of healing miracles. And to illustrate what dosing and accuracy is, let's pretend that all of us on this call went to the orthopedic surgeon's office with a knee problem. And let's pretend it's the same knee problem. So we're all biologically different people, and we go in there. The doctor recommends that we all need PRP to inject into our knee. And so does it make sense? Because this is how they've done it historically for the past 4 decades, to take 10 mil blood draws from each one of us, or maybe it's 30 mil blood draws from Dr. Denny, 30 mils from me, 30 mils from the guy up there in the upper left-hand corner, 30 mils from the woman down in the bottom right, and 30, 30, 30, 30, 30. And then we process it in a centrifuge and then inject it into our knee. So does it make sense that we do the same thing to everybody, considering we're all biologically different? Should we all have the same outcome success? And the answer is no. And until you frame it like that, the problem like that, the answer or the problem is not really that self-evident. So that problem led to me creating the TruDOSE technology in 2018. And so if you go into a TruDOSE office, this is what they do. You walk in, they take a few drops of your blood, and they measure it over here in this device over here. Now, the device only measures your platelets, and there's a lot more that it measures than just the platelets. But what really makes this whole thing go is the software right here. Because the software uses analytics and different metrics and really intelligence to determine one thing. How much blood do we need to draw from you to centrifuge and put back, in this case, your knee? So for Dr. Denny, he might need 105 mils of blood. I might need 62, and the guy in the upper left needs 265. but we would all get the same dose, in this case for the knee, to stimulate healing. So we're going to get our own personalized dose and our own therapeutic dose, because the software has also learned what is the dose response relationship between, let's say, the knee application versus the hair application. And the whole process is 95% accurate to help you produce that particular dose that you want. And it takes about 45 minutes to do the entire process. So when I got started, I just wanted to solve problems that people could easily identify, which was make my knee feel better and then make my hair grow. Now, because the software figured out the dose to make the hair grow, I can submit to you that if you do it at the right amount on the first treatment, you can have crazy results. And there's no need for you to go back to the med spa or wherever you got the hair treatment 4 and 5 times for it may or may not work. What changed my entire world was 8 months into starting this company. Geez, I got allergies. In October, to make a long story short, it's a great story. I won't go into it for this call. But I said, we should do this intravenously, which if you ask normal conventional medical doctor, they would say doing billions and billions of platelets back in the bloodstream doesn't sound like a good idea. But to me, that was a great idea. I was trying to heal somebody in my family. And you flash forward to 15,000 patients later and close to 7 years later, and I can submit to you, this is how people know us. Because it is the one treatment that is reversing, insert the name in the blank of the condition that you want to talk about. It's literally reversing the body's, or reversing these conditions that exist in the body simply by helping the body heal. It's actually a proactive treatment that turns the body back on to heal, just like we were created. And so the question people ask, patients ask, and doctors ask is how? How is this doing this? These platelets were in my body. This blood was in my body. How do you take it out and do the magic and then put it back in? How does that work? Well, it starts with what we were not taught about platelets. So here's a platelet. And if you were to Google anything, well, just Google, what do platelets do? Everything that you'll pull up right away will say something to the effect of platelets are there in your blood for clotting. And that's what medical doctors have been taught. So if you have too many platelets in your body, you need to be on some sort of antiplatelet therapy because you'd be at risk of stroke. If you have too few platelets, you're at risk of bleeding out because you can't form any type of clot to, close up the wound. But is that all they really do? And when I give this talk to the doctor conferences to kind of level set, our understanding, I always throw this slide up there. And I can read the quote by heart. It says, in many diseases, substances are formed which either act as irritants or poisons to the platelet-forming organs, and depending on the intensity of their action, may exert the influence to increase the platelet count or reduce it. And I asked the physicians in the audience to try to guess what year this publication was published. There's always a number of answers, but no one ever guesses this. And so my point to putting this up here is to say, obviously we knew something back then that's way more important to the platelet than just clotting. And so I'm going to go through this part of it really decently quickly. But the part I want you to remember is this: platelets are being manufactured in your body at a rate of about 70 million per minute. And they're basically born from your bone marrow in these cells called your hematopoietic stem cells. And these hematopoietic stem cells are created in the bone marrow, and they travel to your lungs, where your lungs create big and small platelets. Okay, why? Why do they create big and small platelets? It's because many studies point to the fact that platelet size is related to your disease state. So larger platelets are carrying more, viral killing weapons, more bacterial killing weapons, more fungal killing weapons, more repair needs, whether it's nerve regeneration or vascular needs or cell energy. Depending on what the cells need, the platelets become bigger and bigger because they'll be packed on with different things to be handed out later in the bloodstream to these injured cells. So these larger platelets and the small platelets travel to your spleen, where your spleen takes a third of the larger population pool and then keeps them stored over here to the side. So this is turned over at about every 8 to 10 days, the entire population. And depending on the particular, stress event, whether it's emotional stress, trauma, a brain injury, a car wreck, a paper cut, depending on what happens to you at any given moment, will dictate what your platelets are carrying on them, how many are in circulation, the rate of circulation and turnover. And so really our platelets are being manufactured by the body and strategically positioned around the body so they can respond at really anything and everything that can happen to us, which I find kind of cool. So they really function as like the fire departments that are around a given city. You can't just have one, you have to have many, and they are the first responders on the scene. So I can look at a raw platelet count and I can look at it and really determine your human disease state. Well, how does this relate to that therapy? Because if you look at any of the literature, here's one of my favorite papers. Wow. Because it compares platelets to drones circulating in the body. And what do platelets do? What do drones do? They surveil. They have a number of functions. And this paper goes into great analogies and not too crunchy science to give analogies on how platelets, they carry weapons, they carry tracking devices, they carry repair needs, depending on what is happening to the body. So let's talk about tracking devices and weapons. So no matter what happens to you, the moment that something happens to your body, the cells at that particular site in your brain, in your arm, in your leg, in your liver, the cells that get injured go into an inflammatory response. And that response is to shut down my cell wall, eliminate communication with any other cell in the body, and really protect my own self. And so what they'll do is they'll release things in the bloodstream called damage assessment molecular patterns, which are really like messages in the bottle that say, this is what happened to me, this is what I need, this is how much I need, can you get it for me? And then they'll close down the cell wall. Well, guess who has the tracking device for virtually every damp molecule that could ever happen to our cell? Everything from heat shock proteins to energy to mitochondrial function. And this is just a small representation. I don't want to, turn this into a science class, but it just gives you a high level that platelets are out there doing more than just clotting. What about in response to, say, viruses, bacteria, fungus, which really those things underpin 95 to 98% of all autoinflammatory conditions. So you got to have heat-seeking trackers to go find the virus, and those are called pathogen recognition receptors. Which means platelets are constantly seeking out fungus, viral things, bacterial things. They are the first things that come in contact, not the white blood cell. Well, if you encounter a virus, you have to know, are you the strain from this year or from last year? Well, those are called pattern recognition receptors. So what are you? What family or class of virus or bacteria are you from? So pathogen recognition receptors, pattern recognition receptors, chemokine receptors. Here's a graphic of what I'm talking about. What you have here is you have cytomegalovirus. This is the outside of a platelet, and every tracking device on the outside surface receptor of a platelet. You have cytomegalovirus, rotavirus, Epstein-Barr, HIV, Coxsackie, herpes. So when I talk, I said I can give an argument right here based on this graphic that this should be like the new quote vaccine schedule. If vaccines are helping our immunity, not to get into a vaccine debate or talk, but we can do this with our own immune intelligence. It was already built into us. All we have to do is reset it, give it some updates, basically, because this intelligence was already built into us from the day we were born. And the more we interact with viruses and bacteria, the more it becomes stronger and the more it learns. What about repair needs? Well, I always put this graphic out there because it really just presents some shock value. Platelets are carrying around 95% of our body's entire payload of serotonin. Now, serotonin is a hormone that's needed for a number of functions that are important to the body. But with respects to the liver and being able to detox, if anybody does lymphatic massages, and they do all types of detoxing modalities, you need the liver. And if you're going to regenerate the liver, you have to have serotonin. Well, guess who carries around the one thing that helps the liver regenerate? Whoops. What about and other things? What about brain-derived neurotrophic factor? So if you are suffering from, if you're suffering from stroke, cerebral palsy, autism, dementia, Alzheimer's, Parkinson's, insert the neurological condition, you need this brain-derived neurotrophic factor, because that's how we regenerate nerves. And the platelet carries around 99% of it. If you have any chronic condition, including neurological, then you're going to need this vascularity. So platelets carry around vascular endothelial derived growth factor. So those two growth factors right there can get you a long way with regards to many different neurological conditions, and they're all carried inside the platelet. What about we got some photo bombers. So how does this relate to the therapy? Well, to understand how the therapy works, which we're almost there, you need to understand what inflammation really is. If you look at these two graphics, these both represent our repair system and our immune system. And what they are is an order of events and how our body heals anything and everything. And it goes from step 1 to step 2. And to get from step 1 to step 2, there must be certain things that are satisfied, that the body says, they're like checks and balances. The body ensures that everything is the way it should be before it lets it go on to the next step of the process. Well, guess who controls the activities of both your immune system and your repair system? It's your platelet. Now, balancing these two activities is literally how you can live, to be 100 years old, right? Balancing these two activities. And platelets start that process. They oversee it, they govern it, and in some cases, they actually intervene, and they're specifically responsible at certain steps. What happens to us, though, is that we go through this sequential process, and most of us get stuck at a particular event. And our body will leave us stuck in this feedback loop wherever that event is. In this case, we're stuck at step 2 of the repair process, or step 1, which is our innate immunity. We're just constantly in contact and fighting this virus. Many of you might have heard the term cell danger response. Many of you might if you feel like you're in this repetitive loop where you can't heal yourself, this is why. Is because the event, and this could be an event that happened 30 years ago. It could be an emotional event, something that wasn't traumatic or impactful. It could be trauma, but your body is saying, I'm leaving you stuck there until I can complete the event. And so you have this unresolved singular event. Let's pretend let's take a child. Overuse of antibiotics in their adolescent years and their childhood years, which gave them chronic ear infections, gave them chronic tonsils, have to get those taken out. Then all of a sudden, when you're 10 and 11 years old, you have skin issues, and then you start to get into your more advanced conditions where you have hormone dysfunction, you have early Crohn's disease in your 20s, then you have ischemic ovarian syndrome in your early 30s. You have and then it keeps just progressing until you really become neurologic. So you've gone from simple things, I'll say simple, that you can't get out of, from these unresolved singular events to start to stack on top of one another, until you get to the more metabolic category, which is really how the body operates. You know, your endocrine system, your adrenals, things that you can't really see, that are dysfunctional. It's just maybe, it's constipation or diarrhea. We give ourselves a medication when actually that's a problem. We have symptoms of skin issues. That's unresolved things in the metabolic category. This is where Raynaud's comes from, sexual dysfunction, COVID hair loss. But the point is that you keep progressing down to here. Now, this is where you start seeing things. This is where you start seeing, I can't walk. I have mental health issues. So those things are required as a result of unresolved things up the chain. Now, you can acquire these things over a lifetime, or you can happen what happened to my fifth child and be suddenly thrusted there overnight, being perfectly healthy, perfectly normal. And then we go to the pediatrician, and then the next morning we wake up and he was never the same. So what's interesting is that we found that if you overlap our emotional state over those three categories, okay, and this is Dr. Denny will appreciate this, is that while you're in this category one over here on this side, you can still feel connected, you can still feel love, you can still feel grounded. But as you progress to the metabolic, Crohn's, infertility, even cancers in this category too, anger, rage, anxiety. And then when you get to the category three, where you have Parkinson's and dementia, and you have Lyme disease, autism, really advanced stuff, that's when you become disassociated. And so what we found is that you go from this state of the body. You go from this state of the body. Why won't it? There we go. You go from the state of the body and everything working great to this state of where the body is in fight or flight perpetually. And the thing is that when that emotional fight or flight takes over, this is why autistic kids cannot say, I love you. It's not because they can't. It's because their body's saying, I can't afford for you to even think like that. I'm literally looking out for, self-survival. And you have to tip that emotional distress response. Otherwise, the body, you can throw a lot of things at it, but the body simply won't heal, at least not what we've seen. So you have all these unresolved issues, these unresolved feedback loops that the body over time coexists with. So the platelets tried to deal with it, the cells tried to deal with it at the time, but it couldn't complete the event. So now there's this coexistence. And then the longer you coexist with it, the body starts to turn off cellular function. And the more cellular functions it turns off, the more it impacts how your organs work. As the organs get impacted, that's when symptoms arise. And really, that's all the body knows. It doesn't know I have dementia. I got diagnosed with Parkinson's. It knows that I've got 55 unresolved problems that I got to complete from a lifetime of living on this earth for 56 years. And if I can just complete those, I can be normal. This is where the treatment comes in. So I'm going to give you 3 ways on how this fixes those things, and then we'll open it up for talks or discussion. So the second that you take your blood out of your body immediately starts manufacturing new platelets. Remember, I told you earlier about this 70 million per minute. Well, in that 30 minutes that you're sitting there in the chair waiting for your therapy to get ready for you, your body's already repopulated its physiological loss, and now you've regained it. So you haven't lost anything, and then you give back this disease condition, specific therapy. So you have this extra amount, and that extra amount, your body's going to say, great, go start restarting the immune system, go start restarting the repairs around my body. The second way that this heals your body, and this is really where the rubber hits the road, it has to do with ratios. Now, this is a concept that goes all the way back to the Greeks, in that the Greeks observed that if the body maintained a proportional ratio of 4 different fluids to one another, that health was maintained. Any one of those fluids got out of ratio to the other 3, pain or disease existed. And so their sole job was to rebalance it. Well, so this idea of ratios is not something that we do in conventional medicine. For example, if we measure the blood, we can see that the thyroid is way high or way low. So what do? We give a medication to bring it down artificially. Well, what is that? Quite possibly the thyroid is way high because something down the line, 4 or 5 things are quite possibly lower at its ratio to maintain your balance of health and disease. But we give a medication and bring it down, then it causes the body to re-ratio itself again. And so you get in this cycle. And what I mean by that is the hemodynamic ratio of everything in your bloodstream. So you have platelets. At the simplest level, you have white blood cells and red blood cells, but you have all these other things. Whoops. Right? And guess who controls the ratios of everything to one another and is overseeing the balance of the ratios to one another? Platelets are in charge of the function of those cells, but it's saying, hey, reduce your level. Hey, increase your level. Well, the second that you put this treatment back into you, this is what happens. And I mean, the second you put it back into you, because we've measured people's blood a day later, 5 days later, 10 days later, 30 days later, and you really shouldn't measure your blood again until about the 90-day mark, because everything is going to look crazy. And then at the 90-day mark, you will have your new literal homeostatic normal, your new equilibrium. We hear it all the time. People's blood levels there's nothing normal. You measure it 10 days later, it's going crazy. And some things are normal. Some things are way out of normal that weren't even a concern. You measure it 90 days later. Most of the times things resolve and they become normal. Like everything that was abnormal becomes normal. And the last reason has to do with those repair loops that I talked about. Because the way the body heals itself, it heals itself in an order of importance. And it could be something that it goes back to an event, again, from 30 years ago. It could be childhood trauma that you witnessed your mom and dad, and it was just bad. It could be PTSD. It could be obviously an unresolved fracture from a motorcycle accident. It's everything that's happened to your body that's piled on. Your body goes back to it in an order that it only knows and says, well, here, this is what you've been missing this whole time. Let me give it to you. Because let me back it up. Because once your platelets are in the body, they're taking care of everything at that moment. But the second that you take them out of the body and they're sitting here in these syringes waiting to be processed in the centrifuge, there's no information being exchanged between the platelets and the injured cells and the injured organs. And the second that you put it back in the body, that entire information feedback is reset. So it's like booting down your computer and then booting it back up and maybe giving it a software update. And when you put it back in the bloodstream, it's like, oh my gosh, well, let's get this party started. Let's go back here and fix this one thing. And then once I fix this one thing, this green circle represents the circadian rhythm. So once something's completed, that's why we've seen people re-enter great sleep for the first time. So if you're not in pain right now, but you're having, bad sleep, that's code for you have unresolved issues. It just hasn't gotten neurologic yet for you to do something about it. So little by little, you get this treatment and it just starts fixing loops. You start resolving those loops and you start going back up the ladder. You start going back up the ladder from neurologic to mental health. Then you get in here the metabolic, where it's working on the body. And it really, depending on how many treatments you want to do, depends on how healthy you want to get. The great thing, I would say the most powerful thing that I've witnessed and seen is how this treatment shifts people in this fight or flight, deep, bad emotional trauma, things that you don't want to talk about. It's going to come to the surface, and it needs to, because those are things that are inhibiting you from healing. And so that's why we see, men, women, autistic kids. They go from not being to experience life with great joy and connection to all of a sudden reintegrating, experiencing love, cuddling with their moms, saying "I love you" spontaneously. It's powerful. So the treatment will work typically on your brain, your heart, and your lungs first, because those are the three most important organs. And the fourth, fifth, sixth, seventh, eighth, ninth, 10th organ that it works on is going to be really dependent on you. I can tell you that the 11th and 12th organ, which is out of the 12, the 11th and 12th of least importance. Number 11 is going to be your musculoskeletal, and number 12 is your skin. So that means if you have joint pain, and unless you're an elite athlete, playing for, one of the Florida teams, you probably don't have knee problems. You have something that's up the chain that's wrong. It's just now presenting itself as a knee problem. So in conclusion, this is a treatment that's using your blood. There's nothing added to it. It's using your platelets, and really the intelligence of what we've been given since birth to restart and reset your body's immune and repair system to help you exit out of those feedback loops. Little by little, the symptoms go away, and then you slowly, with each treatment, start to reverse health and the condition, whatever it is you're dealing with. So, Dr. Denny, I'll open it up right there.
Okay, well, thank you, Tapley, for that presentation. I see we have several questions from people who have been watching the meeting. You have those on your end, I'm assuming.
Here we go. Yes, I do.
You want to tackle those first?
I'll tackle these. Yes. Is this considered stem cell? Not really. Stem cells, if you remember the loop, the circle loop, stem cells are needed at the end of the process in what's called biomass replacement. So when you build a house, you have the foundation, you build the structure with the wood, then you put on the brick, and it's at the last stage where you put drywall and trim, right? Or paint, sorry, painting and trim. I'll say paint. Those are the details. Stem cells are like the painter and the trim guy. They're needed at the end of the process. Most of us are stuck in the beginning, like I was showing you. And so the problem is with stem cells, if we're stuck here early in the process, stem cells are needed over here. We're basically bypassing several events that the body has to undergo, must undergo. And so the best you can hope for a stem cell response is basically an immune response. And then there is no response because the body says, I'm not ready for stem cells yet. So it's not that stem cells don't work. It's just that we give it at the wrong time. But this stem cells would be, unless this is not stem cells, it would be regenerative in the scope of stem cells are regenerative treatment. And this is helping you repair things that have been damaged, but it's not like, quote, stem cell. What happens inside the black box? What analysis does it perform and how does it use them? So you're basically asking, basically what you're measuring is the platelets. Now, I just went through a number of things that we didn't know about the platelet and how important it is in the body. And so if it's related to health and disease, you can imagine all the different types of tests you can take to determine what's wrong with the body at the cell level, at the nutrient level, at the nutrition level, you can imagine everything you could do. I took those tests and basically stuffed it inside of a platelet, because if it's monitoring health and disease, then I had to make sure that something was easy to test. Now, the platelet count is a critical value that determines whatever how much blood that you need. But um, but basically, it's not telling you what disease you have. Although in the future, never mind. But all it's telling you is basically how much blood do we need to draw from you to produce whatever therapy it is that you're complaining about. Um, I hope I answered that question. So it's just measuring platelets. So someone says, I'm suffering from chronic gut health issues. What is the extent this therapy can help heal or correct gut bacterial like disability? Yeah, all the time. Kids with PANS and PANDAS, people with Lyme disease, people with Crohn's disease. I was in Oklahoma last week, and this lady was complaining about all kind of things, and she had a chronic ulcer, and like, yeah, it'll do that. And it did. I came back and I saw her last week for a second treatment because I happened to be there, and she said it's gone. Now, other things she complained about were, some were better, some were not touched yet, but the order in which it'll address, in this case, this person's asking about their gut. In which order it'll tackle the gut imbalance versus say something else that's maybe causing the gut imbalance. I can't tell you that, but will it do it? Yes. Do we have many people, kids to adults, that all types of gut and intestinal digestive issues all the time? There's a question about, is this a one-time treatment or is it reoccurring? And I will go ahead and add in the second question: how many treatments are needed for Hashimoto's?
Thank you. That's me. That's me. That's why I'm here tonight. I know how to take care of this thing.
Man, you listen. You did Zoom for the first time, and you did the chat. You're like,
I'm a seasoned pro now.
You're like 2 for 2. So the treatment, if you have a disease that falls into the category of either category 2 or category 3, just prepare your mind for at least 4 treatments. So if you have mystery disease, in this case Hashimoto's, you're going to need to prepare yourself for 4 treatments. Why? It's because because Hashimoto's and many of the things that probably people are on this call for are metabolic, they're neurologic, they've taken a long time to acquire, and it's going to have to peel the onion back layer by layer. Each treatment will. If you do one treatment, which we didn't know in the beginning, it'll get you better, but it's not going to prevent you from getting it's not going to get you that much better to prevent your body from wanting to go back and relapse. At about the 4 treatment mark on average is about the point where mystery disease the likelihood of relapsing is greatly minimized. It's also the point where we've seen people get off virtually all their medications within reason, a lot of the supplements, if not all of them. So your monthly medical bill spend is greatly reduced. And people end up doing it after the 4 treatment mark. The majority of people, greater than I think it's 80%, they keep doing it as a preventative because it's like, why would I stop? I'm already here.
On what kind of frequency would they do that maintenance kind of treatment? Is that once every 3 months, a quarter, or twice? How do you evaluate that? And do you use the same metrics to measure the blood number that's used with the other guys, which I didn't have so much good success with?
Yeah, the frequency of treatment is about every 8 to 12 weeks. So you were right on that. You said every 8 to 12 weeks, once a quarter. So it's yes, it's both of those. The what it's measuring each time, your symptoms would change. One treatment you're complaining about nerve pain, the next time you're complaining about gut issues. The next time you're maybe not complaining about anything except just and then the fourth treatment, it may all of a sudden spark up, be working on the thyroid. So you
Okay, so it's going to
with
go in. That's like you said before. It's going to go into that series of problem solving step by step, and Hashimoto's may be like down at the bottom of the rung.
That's right.
So other events will happen prior to the thyroid situation, possibly.
Well, that's what Tapley was describing about how problems get deeper in the body, and then healing occurs in reverse. There's in German natural medicine we call it vicariation is the worsening of the conditions and the deepening of the conditions, and reverse vicariation is the healing. So as you start to heal, as Tapley says, it's like peeling away at an onion. You get rid of one thing, and then something else will resurface. A lot of medical systems have terminology for this. In chiropractic, it's called retracing. In German medicine, it's called vicariation. So healing goes in a stepwise manner, and new things can crop up as one heals, which are actually old problems that for many people that they've forgotten about. But that's how the body generally heals.
This blood treatment has a similar ring to it to as the Chinese method of oxygenating blood through transfusion.
I'm not familiar with that. I practice Chinese and East Asian medicine.
Ozone therapy.
Ozone therapy is actually not a Chinese therapy. We apply ozone therapy here on a regular basis for patients, and it's all part of
That's where I first learned about it in China, where they do that
right.
45
So
minutes of
ozone therapy,
transfusion.
in ozone therapy, you take some blood, you mix it with ozone, and then you pass it back to the body. It excites the immune system to heal. It detoxifies the body. So yes, there are a lot of ways to facilitate the healing of a body, but oftentimes patients don't have the healing level that we would like. Um, and adding a regenerative therapy such as TruDOSE has the potential for breaking those cycles that people have and resetting things in order to move things at a faster pace back to healing. The goal is to get people healthy and to minimize what people need to do in order to get back to that healthy state. And this has great potential to do that by resetting the body and resparking the body to heal at a more deeper level using um, its own tissues, if you will, in order to stimulate that healing process. In addition to perhaps layering it with other things such as ozone and natural medicine and acupuncture, whatever the case may be. But the goal is to always get healing back to happen at a faster level, to un, to peel away that onion in a more efficient manner, to reduce costs, reduce expenses, and get people healthy as quickly as possible, basically.
So if I'm coming in with my initial complaint, say this diagnosis of the Hashimoto's is what I'm working for, is the test still the blood sample where they read a certain range of thyroid in the blood that determines, well, it would determine to them how many milligrams of the medication they were giving me.
Right. Well, Tapley, how would we address that issue? We're not looking at the blood test in order to the conventional labs to determine what our dosing would be with the TruDOSE. So how does that translate into the testing and decision making with the TruDOSE?
Yeah, I mean, we wouldn't be using that test because the body doesn't recognize, and it doesn't know what disease is. It knows I have unresolved problems. We use disease terms to communicate effectively with one another. You know, you take symptoms of Alzheimer's, you take out one or two and add maybe one or two, and then you have dementia. You take out another one, you got MS. So which is it? So the body knows unresolved problems, and the platelet count is an indicator of where you are in that disease progression as far as like the sliding scale. So you very well have Hashimoto's, but the problems that you're currently experiencing now may not be Hashimoto-esque. So it's whatever you're walking in with that given time
Okay.
would be what we tackle. And then the next treatment is the next treatment would be, well, now my thyroid's working, but now I have all this pain in my right leg. Well, what was the problem there? Well, actually my had no feeling there. Well, it's because your nervous system's working again. But
Yeah.
let's there's because this might help you answer your question. There's another question that talks about how important is detoxing the body as much as possible prior to starting treatment, and does it improve the chance of seeing results faster? It does. I mean, that's it. So it at a high level, if you have a condition that needs detoxing, yes, I've already talked with Dr. Denny, the Denny's, and they have some of the protocols that maybe some of you might need depending on your condition. For example, if you have Lyme, there's a particular protocol. If you have, TBI, you wouldn't follow that same protocol. And it's more of, let's just call it prep. Will prepping and detoxing hinge the treatment? And no, not really. It'll help maybe your gains on that particular treatment get more because you doesn't have to expend a bunch of energy doing stuff like detoxing. But then again, detoxing, for example, now that I'm on the subject, is a great thing. Lymphatic massage, infrared sauna, red light therapy, the whole 9 yards. But when you do this treatment, you really need to let your body rest for about 10 days, because if you do anything if you go right back in the infrared sauna, it's just too much for your body to handle, because this treatment's going to make you detox like you've never detoxed before. It's going to make you work. Those therapies, once you get past the 10-day period, then they become the essential piece to keep you going. And you would work them back in, based on what the providers are going to prescribe based on what it is that you have. So if you've got Lyme disease, doing hyperbaric oxygen would not be a good idea, even though it's a great therapy. If you got TBI, hyperbaric oxygen is a great therapy. Both neurological injuries, but you can't do one thing for both. So it'll, and the long and the short of it is the treatment will reveal, what thing is not, what's not working as far as detoxing. Is it the liver? Is it the gallbladder? Is it lymphatic? It'll reveal which one's not working right away to the providers, so they'll possibly take away a supplement that you don't need anymore. They might give you one that's like, okay, now I know it is the liver. Before we didn't know, we just gave you all of these. Now we know it is a liver problem. So what are the potential side effects, and what particular labs are out of norm when you say if checked shortly? Side effects, there really is not any. That's other than herxing. And if you don't know what that herxing is, it's just the body going through basically a healing crisis. And we'll talk about, there's no really side effects that's ever been reported. When I say labs, I'm in this case, I was talking about CBCs and CMC counts, typical stuff you measure that would be typical diagnostic. It's just what's wrong with you. There's a question about how does it help autistic people? Does it help with developmental delay? Does help with cancer. So I was going to pull the data set up here. I'll answer the autistic question real quick because we were just at the Medical Academy of Pediatric Special Needs, and we were just gathering some recent data, some new material, if you will, on autism patients. These were surveys that were filled out by the patients. These were ATEC, Autism Treatment Evaluation Checklist, if you're familiar with that. It's an extensive testing. It's how they really, it's kind of like the standard they use for measuring domains of autism, uh, uh, I think it's health and behavior, sensory, language, emotional. Anyway, at a high level, there was a little over a 42% improvement within about 2 treatments with all the kids. I believe it was 40 to 42% for all the domains except the language. The language was around a 30%, which are mind-boggling results for the types of for autistic kids, for kids who had been treating their condition for a little over 70% of their life. But if you look at their progressional journals or the progressional notes from the doctors and you match it up to that objective score, it doesn't even tell the same story. Some kids, were autistic kids had type 1 diabetes and are no longer diabetic, and had gut issues and no longer having gut issues, were hitting themselves and no longer. So how do you quantify that? And my point is that the healing journals or the healing progressional notes of the doctors tell a much more impactful story than that data itself. So it does help autism. Cancer, and developmental delay. You're talking CP, dyslexia. We're going to have a Zoom call with a lot of the moms with CP and dyslexia because you just wouldn't believe it if I told you. I think Elena's on this call. Elena, maybe you can talk about a couple of the cases out of Houston, the pediatric stuff with developmental stuff.
Sure. Hi. Let's see, I just spoke with one of our doctors and she is finding a lot of her kiddos after 3 and 4 treatments are actually no longer on the spectrum. So what it's doing neurologically for these kids is really reversing the autism, if you will. Dyslexia is one of those things that we find is almost like a side benefit that comes with this. Personally, I'm 53 and I'm no longer dyslexic, which is really wild. So you don't have to be a little to have it shift. And I think what else is coming out of, I'm trying to see what the question was about.
Well,
cerebral palsy. Question was.
I was talking about just the cerebral palsy.
Oh, yes, we have one kiddo who's just turned 20, who had never walked, was always locked and in a ball. And he is now, after just 3 treatments, eight weeks apart were the first 2, and then the third one, they waited 3 months. And he's now walking with a cane, holding his own bowl, and he's able to communicate in a way where his parents have had to go through and baby proof the house, if you will, and it's completely changed the way they live, because he's now he can verbalize the best that he can feed himself, he's walking, he's climbing on the couch and turning the TV on, climbing in mom and dad's lap to kind of cuddle. So it's, and this happened at 19 and now he's 20. So incredible things seem to be happening with the brain around this and the kids.
I mean, the kid was we were there. The kid was his CP was so bad that you couldn't unclench his knees and his arms. He was in a ball. That's how what his whole life was a ball. So now he's walking with a cane, which is kind of crazy. Can the treatment help with rheumatoid arthritis and joint pains, damaged joints? The short answer is to joints, yes. And again, we'll get into this if you did the treatment, and a couple of weeks later we'll do the what does healing look like Zoom call. And if you have, unless you had an acute injury that you just suffered, on the basketball court, the rheumatoid arthritis and joint pains, again, are the bottom level of importance to the body. So meaning that there's going to be a lot of improvements upstream to your whole body. And one of them might be less joint pain, but we see it all the time. People that are on Celebrex and other types of steroids to manage that pain, and don't record this, but they get off of it. They usually on the first treatment, they just stop taking it. Would this benefit someone who's on dialysis? I think the better question is would this benefit someone who's in chronic kidney failure? I can answer that question a lot better, because we've treated about a half a dozen people who are at end-stage kidney disease. I can send you their testimonial videos. They were on the transplant list, and after one treatment, they were no longer on the transplant list. Same thing with the liver, and someone was on the heart, but I can't tell you definitively if actually I know he's not on the transplant list, but I can't tell you definitively it was because of this treatment. He was doing a lot of other things, but based on that, I would assume that it would. You would like to know how this could help for chronic pain, joint deformity. Oh, I think I already answered that. Wait. Okay, I just answered that question. Exactly what? Okay. Is this more suitable for healing gut issues than ozone therapy? Yes. No, they're complementary. They're two different types of therapies. They both come from the blood, but you should consider ozone at more like stuff in the bloodstream that's circulating in the bloodstream. You should consider, and so ozone, I don't know if I would consider that a reparative therapy, although it does lead to a lot of reparative benefits. So killing a lot of stuff in the bloodstream simply by getting that stuff out of your bloodstream is healing itself. This therapy, on the other hand, is going to go after stuff that's trying to hide in the tissues, that is trying to avoid your gut defense, that's hiding in the gut, and it has, biofilm and has basically these things in the body where I can't tell you, I can't speak intelligently on if ozone can do that, but I would say that these two therapies are complementary to one another. And I would say that this therapy is more reparative simply by its nature. What specific tests are required to do before the TruDOSE? Really none. I mean, just come in as you are, as they say. And, there will have to be some certain things that you'll need to kind of get off of, but it's whatever your state is right now and whatever the condition is, it's fixable. There might need to be some education going on depending on everybody's, education level with, if I said the term herxing, do you know what that is? If I said detoxing, do you know what that is? If I said that, if those are unfamiliar terms, then it's just the fact that a lot of the ways that we've consumed medicine for the past 100 years are just that. And this is the complete opposite. This is how we used to do. This is going back to the roots of, if we can all believe that our body was innately created to heal itself, this therapy brings that back out. I'm doing ozone therapy. Good. I mean, the ozone's great. I'm not, this is, but this is, think of ozone as like a, I'll go with baseball analogies. The ozone is going to be like the changeup or the curveball, where this is the fastball. You're going to rely more heavily on this, but you got to use the ozone as use the ozone to either prep the body before this treatment, or use it as a treatment to keep accentuating the benefits after you get this treatment.
Yeah, the ozone therapy, it modulates the immune system because of the effect of O3 on the body. Is it's a regulatory therapy in altering how the immune system behaves, and so if somebody has a condition that's too high, it brings it lower. If somebody has a condition that's too low, it brings the body back into balance. So, but it's influencing the body from the outside in, even though we're using the blood as a tool to make those changes, whereas using one's own body fluids and platelets and growth factors is approaching it from a different angle, if you will. So they are very complementary to one another. And of course, ozone has a natural effect of killing bugs, if you will, because of it's a highly it places a lot of oxidative stress, and bugs just don't like that. Neither does cancer, for that matter. And so it has a lot of positive benefits, but it's working from a completely different perspective.
I was going to say, there's a question about low dose naltrexone. I'll get with the providers, but I can say that's one of those medications that you really need to try to come off of before. At a high level, if the whatever you're taking is its main property is anti-inflammatory, then you probably need to start weaning yourself off of it with the help of a provider, because those will simply just inhibit the effects of the treatment. What are the predominant criticism that this therapy draws? What are the objections to it and the alleged issues? I wish I could answer that question. I don't say there's really much criticism. I think our first criticism came in our portal like about a couple weeks ago. Somebody was complaining that this therapy isn't cheaper than it is, but I don't control that. But that's really the only complaint that I've ever seen, to be honest with you. Objections, I think, I really haven't come across that either. Most patients get this, or the part of them that can understand it from a gut perspective, they get it. Sometimes physicians ask me about published data, but then I say, well, there's no need for us to publish it. Why would we do that? And physicians mostly who need published data to validate what they do, which are not people probably on this call. I'm just trying to be very transparent and honest with you, but we don't really get much criticism. And as far as the price, all the providers around the country, I know this much. We went around to all of them about a year ago and said, listen, you can't be charging $3,000 and $5,000 for this treatment. You can't. So we got everybody pretty much, everybody charges the same pretty much everywhere you go. And it's crazy affordable. Would this be contraindicated for a patient who's on immunosuppressants? Yeah, I would say it would be contraindicated while you're on those, just simply because step 2 of the body's natural way that it wants to heal anything is to stimulate the immune system to activate. So if you're taking something to suppress the immune system, you're really gonna you would so you want to wean yourself off of that with the help of a provider. So immunosuppressants and steroids, those are like defensive treatments. This is a proactive offensive treatment. It's getting your body back on the offense. It's getting you off your heels, your immune system off its heels. Is there an optimal diet? Well, that's already been answered in the chat, but you really, you this treatment doesn't replace everything. You need to make lifestyle changes, and depending on the protocol, it'll overcome a lot of things. But there's no really optimal diet. I would say getting on reducing inflammatory things is pretty much across the board going to be the recipe for anybody's success. How old is it needed to be? Well, okay. These are being answered in the chat. Sorry. As young as 2, and I know as old as 98. As far as costs, I'll let Dr. Denny speak to that. But again, I know that because I know they may offer some different, things to kind of if you're getting IV nutrition and different things, they might have to give you guys some price breaks or things like that. But
Yeah, I mean, it's like anything else. We're figuring it'll be around the $1,500 mark per application, and then there could be some packages and so on, gives people discounts. So it's pretty typical. It's not an outrageous fee by any stretch. It's certainly a lot cheaper than the 50/50 that you get from stem cell treatments and things like that, which cost thousands of dollars per application, and it's oftentimes very disappointing. We're going down a black hole here, but let's keep in mind, everybody, that platelet-rich plasma applications has extensive data, and it's been used quite a bit over the period of many decades with great success. So, we're not necessarily reinventing the wheel; we're just refining it.
this might be a time, and Elena, maybe you can speak up, because Elena doesn't just work for the company. Maybe Elena, you can just give the high level on your story and what you see the questions we're going, because these are really important questions. They need to be answered, but it's easy for me to say, someone who doesn't live with chronic disease, what do you?
Am I muted? No. So I found the therapy 2 years ago. And when I found it, I had essentially been in bed for almost 4 years. I had written letters to my kids. I had suffered from chronic Lyme, systemic mast cell, POTS syndrome. I have something that mimics MS, dyslexic. I had TBI situation. I actually had brain surgery. Mold illness, all the different viruses. What am I missing? Hashimoto's, and co-infections. So, my first treatment was incredible. I have not had a mast cell reaction since. I continue to do the treatments because of the way it saved my life. And at the 6-month mark, after 3 treatments, I actually went to work full time. And it was literally from, I had days and weeks where I couldn't walk up the stairs in my house. I couldn't drive 50% of the time, or I'd get somewhere and I wouldn't know how I got there, why I was there. So my brainstem activity would always shut down. So for me, now 2 years out, I've had 1 tachycardia POTS reaction in this whole process. I am no longer susceptible to mold like I was, and I have all the different variants, MTHFR variants. So I can be around it and my body detoxes it now. I no longer have Lyme bands. I'm dealing with one last co-infection, Babesia and I guess Bartonella as well. So I work with a couple docs, and they're putting all kinds of protocols together around TruDOSE because it has really been the only thing that was able to get me onto the other side of my health. As I said earlier, I'm no longer dyslexic. Cognitively, everything came back. My energy is pretty much through the roof. I travel, some weeks, I'll go on 3-week stretches of travel for work. And, I'm able to sleep, and all the hormone stuff is fairly regulated. What else am I missing?
That's a lot.
It's a lot. And, I guess the other thing is I've had COVID a couple of times, and I'm exposed to it all the time being in all these clinics. And we just did a lot of blood work, and my doc does a lot of clean hearts, ART, and I don't have any spike proteins in my system. I no longer have parasites. I was dealing with that for about 6 months, and I tried doing a cleanse, but I simply didn't have the time. So these continued treatments, the parasites are out of my system. My body's not harboring mold. It's just, we literally have 2 co-infections that we're dealing with. So, and it's only been 2 years.
What about cost?
Cost? Oh, well, I was spending $1,500 a month just in supplements alone. So for me, this was this was easy, an easy transition to make. And I don't have to spend my life with appointment after appointment in, red light. If I do red light, it's because I want to now. It's not because I need to. So, I have a health protocol that I do that is very much when it works with my schedule, saunas and, IV therapies. I tend to do that, on the road, but I haven't needed a lot of extra support, but I still do these. I do these every 8 weeks.
There's a question about here about having low platelets. The therapy will still work. One of the things that everybody will need to take before treatment is I'll get this with the Denny's is papaya leaf extract. So papaya leaf extract, excuse me, go down to your local nutrition store. We're formulating our own little concoction of it. But for right now, go down to your old nutrition store, papaya leaf extract. Usually take double what it recommends, and there's not lots of literature on papaya leaf extract with increasing platelet counts. It'd be great for immune defense too. Yes, you can. I'm gonna give a recording of this to Dr. Denny and let you guys kind of just filter it out. So usually
getting back to the cancer thing. It's always a touchy subject. You have people on chemotherapy, and can this be done? When should it be done? Should it be done at all?
Yeah, the cancer question is just something that I'm always just cognizant of how I answer. Here's what I can tell you. So many people have sought this out for cancer, active cancers, dormant cancers, cancers of the brain, cancers of the bone. Just if you look at the literature with regards to the connection between cancers and, say, bugs, parasites, viruses, we'll call it viruses. There's a direct connection. It's known for almost a century. And I just showed you what platelets actually do to viral bacterial killing things. So I always answer cancer in regards to look at what I just showed you, look at what causes the connection between what potentially causes cancer, and draw your own conclusion. I can tell you that many people, the people that have gotten treated by this with cancer, all I can tell you is that it helps with their pain and their quality of life dramatically. They seem to
right. I didn't mean it in the context of treating cancer. In supporting patients with cancer, much in the same ways we apply other therapies. So we're not oncologists, we don't treat cancer, but we support patients' health of patients with cancer so that they can do better when they're doing their conventional cancer treatment. So it's in that context.
Oh, then this is it. Then you get tons of support then.
Right. So the question is, um, and of course, this is going to be an individual thing from individual to individual with respect to the type of treatments that they're having. But a patient is having chemotherapeutics on a schedule, and um, where does this fit in that cancer support?
Oh, okay. I mean, I wouldn't do this during, kind of. Let me give you an example of, someone call. That way, I can let you kind of guide it. Someone called, about 3 weeks ago, and they literally just had a stroke. The provider called and said, can we do it right now? And I said, typically what we see is that you kind of let this, the stroke kind of like let it die down for about a week. Let the body kind of come out of that shock and then hit it. Don't hit it while the body is actually doing its thing. So if you had to, I don't know what all goes into cancer treatments, but if it's something that's active you're doing, and I know you're probably doing supportive therapies one at a time,
right?
Then you probably want to do this after, let your body kind of like rest for a little bit and then hit it with this.
Okay, fair enough.
All right, here we go. There's a question about, how does this help with Epstein-Barr and peripheral neuropathy and Parkinson's, and can it regenerate nerves? So Epstein-Barr, 100%. I know Elena gave her story. She had Epstein-Barr, and we got blood data and lots of people with Epstein-Barr, and it pretty much gets rid of Epstein-Barr. Not just reduce it, but eventually just gets rid of it. Parkinson's, the one thing about Parkinson's is that it's such a metabolic, this is not, I don't have a medical opinion, but there's a lot more metabolic things that are wrong with the body that are causing the neurological stuff. So the thing with Parkinson's is that will it help these people? Yes. I'm trying to help manage the expectations in that you'll see their gait get better. You'll see their ability to their affect, how they, their old self will come back. They're out of this kind of state of just blankness. It's like they come back. The thing about Parkinson's is that everybody wants to get rid of the tremors, and because of those, that's the most visible thing. Sometimes it does, sometimes it doesn't on the first 2 treatments, but it does work on a lot of things underneath. I can think of one guy that's on every Zoom call we do in Minnesota, every one of them. Before or after, he's just on all of them. And I was under the impression that he did okay the first treatment, nothing the second, nothing the third. And this is over, close to an 8-month period. And I had just learned the other day, because he jumped on, that the 4th treatment finally he saw what it was that he wanted to see. Now, he had been making minimal gains that everybody else could see except him. But on the 4th treatment, it finally just threw him into, it was finally what he wanted to see. And he was having these dramatic results. So my point is that Parkinson's and MS and dementia-like things, there's so much emotional state that you got to really slowly pull out of it. There's so much gut metabolic things that it's got to work on, that the things fixing are going to be things that you can't visually see. So it's just an expectation thing versus like neuropathy. Neuropathy is kind of, you'll see it right away. Walk has gotten balanced. Yeah. Those things will improve, and sometimes when you have neurological things that are that advanced, sometimes the walk will get better on the like way better, though. You know, you hear a story from the CP kid going from not ever walking in his life to now with a cane. So you'll see those shifts, and then all of a sudden, the second or third treatment, the walk gets worse. And what that is the body going back and it's rewiring things in the brain, and rewiring things just in the nervous system. And while it's what, you know, because when you have a neurological condition, your body learns to create workarounds or kind of or and at some point it's got to address those workarounds and reestablish the original connection. And it's the second treatment, third treatment. You know, see this happen in autistic kids that might get a little worse, then all of a sudden they'll shoot way past they were. So, and that's just the body kind of rewiring its neurological pathways. You know, when one thing we haven't talked about is like, say, post-COVID, like long haulers and inflammatory hair loss, fatigue, memory, just overall energy, emotional, just everything that kind of COVID has done, is still doing. When it comes to COVID, it's almost like the one thing that we've seen, it's pretty consistent on the first treatment. It just knocks it out. You'll have really dramatic gains, particularly with energy, particularly with fatigue. Women who have, and even men that, you know, just keep handfuls of hair, just stops. Sometimes it's burning urination that goes away. You know, depending on whatever the symptom is that's neurological sensory related. If it's COVID related, it kind of puts those fires out pretty quickly. So yeah, so if you've been down to the med spa and you've gotten your hair treated and you haven't seen any results from it, quite possibly it's not because that that it's, you know, if you have inflammatory hair loss or you know, Hashimoto's and losing your hair, then you've got to treat the underlying things in here a couple times and then come back to the head and give yourself some injections in the hair, and you'll grow some hair. So Dr. Denny, real quick, when is the treatment date?
Treatment day is going to be Friday, October 4. That's going to be our launch date.
And
anybody? Yeah.
Well, and typically what we, and I just want to, you guys do it, all the providers that use this, they typically only do this on 1 or maybe 2 days a month.
Right.
Is that how y'all are doing it?
We haven't made that decision yet.
Or it's only going to be, well, I guess my point is that treatment date is only going to be a limited number of spots.
Well, yeah. I mean, there's only just so many people we could process in a day. And from that point on, from what I'm understanding about the process of taking care of the patients, there's a lot of time involved. So it probably would be in our best interest to do specific set days in a month in order to accommodate these patients, because it's not something we could just do on the fly, like an ozone treatment or an IV poly MVA or whatever the case may be. So because there's a whole analytical aspect to this prior to administration, it's not something we could do on the fly. So we're probably going to have to secure specific days and times in which we'll be doing this procedure. That's probably the best way to work it. So yeah, I think we're gonna go about it that way. So if anybody's interested, they're more than welcome to give us a call. Tomorrow's Wednesday. We'll be open all day tomorrow, and Thursday we'll be here all day as well. Friday half day. Most of you know the phone number. It's 954-473-8925. We'd love to hear from you. I had one quick question here, though. I have a patient with thalassemia. So she has, to the best of my knowledge, shouldn't be an issue, but she does have small red blood cells. But I don't believe thalassemia patients have any issues with their platelets. Um, I would assume that it would be okay to treat her with this treatment for her overall wellness. Do you
Yeah,
have
you
any thoughts on that?
yeah, things with the red blood cells, you might, and and hemoglobin and things like that, you might see those things. You might see those things have a dramatic shift. So it won't be a problem, and just be on the lookout for those things shifting in the bloodstream.
Yeah, I would assume we would want to take a good look at her labs prior. Uh,
One last question here about so for viruses that hide in the nerves, like HSV or other viruses like HPV, the answer is yes. We'll be able to clear it out. I can uh, pull the blood data up. I can show you from herpes virus to the HPV to the cytomegalovirus to the Epstein-Barr to the um, you know here's what you should expect. These types of viruses have made it their business to establish a residence in your respective body, and they're there because they've become good at hiding. So the first treatment may very well get out the typical suspects that are in the bloodstream. Now we can do some things to kind of draw things out of the tissues as best we can before the treatment, like ivermectin and some other things, and uh, and um, and with some high dose vitamin C the day before to prevent these things from crawling back in the tissues. So that way you have everything that's line of sight in the bloodstream, and then the day you give the treatment, it's basically a bad day for those things. But you have to think about it. The defenses and the immune intelligence has now been given a software update. So these things' ability to hide has now been diminished. And so even if they go hide somewhere else and become latent, actually, they won't become latent. You'll typically see viral things activate, which with this, I don't want to spoil our Zoom call follow-up, but you might see, things like these latent viruses become activated. And if they do, don't freak out, because one of the healing mechanisms for your body to actually heal something is it has to bubble it up. If it's an old motorcycle injury, if it's childhood trauma, if it's trauma from the war, your body has to bring it to the surface. And when it does, it's addressing it. And then if it goes away, that means it's done. You'll never have to deal with that again. You might get HPV again, but it won't be because of this particular strain that's been living in you for 30 years. So I hope I answered that. So there's a question about, basically high level sexual dysfunction. The short answer is yes, whether it's male or female. If you think about it, sexual dysfunction is not just a vascular problem, but it's also a neurovascular problem. The emotions and the ability to connect from a just a human perspective is much neurological perspective is much more important than that it actually, the vascular problem of the area down there, whether it's female or male. We've seen this all the time. I won't put Elena on the spot, but but we see this all the time with adults, and that it's one of those side benefits that it's just watch out, it's going to get enhanced. So this, and the question's asking, would it be wise to couple the treatment with ozone and do ozone the days before? Yes, depending on what you have. It would be wise to do a number of things to prep yourself, depending on what you have, before. Just going into this cold turkey is fine. But if you want to get optimal health, you can have a planned protocol that they can execute with the Dr. Denny and Justine that can do, you know, this on day 1, this on day 2, this on day 3, then TruDOSE on day 4, and it'll be much more targeted. And so, and they have all that information. They just gotta, I think how this most works is you give them a call and they hold your spot with a deposit, and they'll probably go over an intake and a protocol, and you know, I'm sure I'll probably be seeing hopefully at least 1 or 2 of you on October.
Well, we're really very excited about this because we're passionate about regenerative therapies. And you know, just to summarize for a moment, it's like the benefits of platelet rich plasma with the you know the platelets themselves and the growth factors is in front of everybody's face. And it was you, Tapley, that made everybody realize, like, why are we using this for so many other health conditions? Why has it been limited to hair loss and orthopedic problems, if you will? So thank you for your pioneering work in this field, and we look forward to getting this off the ground and helping people to get to a healthier place. Do we have any other last minute questions?
There's one more, slipping it in there right at the buzzer beater. It's asking about, I think it's asking, does this treatment reverse MS from the top going down or coming up? This person's kind of spoiling my talk with regards to the follow-up, because the follow-up call 2 to 3 weeks later has to deal with how does the body heal. And I think what this person is asking is that, you know, one of the principles of how this treatment heals follows what are called Herring's laws of cure. You can go look that up, Herring's laws of cure. One of those laws is the law of top down. So to this person who asked this question, it could heal you from top down. It could heal you in reverse order. It could jump out of the reverse order and go to top down. They're not really mutually exclusive from one another, but it's kind of cool that you even know that concept, if that's what you're actually referring to. So at a high level, you'll probably with MS start to see a lot of neurological improvements, and you'll start to see, you know, brain, heart, lungs. Those are the top 3 important. And organs 4 through 10 are going to be dependent kind of on the one guy said earlier with Hashimoto's. It could be the thyroid for somebody as the 4th organ. It could be the pancreas for somebody else, what it's working on next. And then, but joints and skin are going to be last. So I think somebody asked earlier, will it help eczema? It will. But no, if you have eczema, that it's something that you've got other issues going on that are upstream. All right, last question. Do we know how long or how many treatments it will take to clear viruses and test negative? Okay. Well, listen, I have blood data that I don't want you, this is not, I have blood data that shows things like HSV, EBV, cytomegalovirus, HSV were completely just cleared out of the bloodstream in one treatment. And some of those, I think it was 70% of those people who had EBV were cleared out. Now, that was a data set of 18 people. Can you extrapolate that to someone who's lived with it for 50 years? What can I tell you definitively? First, second, third treatment, its days are numbered. If your goal is to get it out of your bloodstream, it will. Elena's a great example. Elena, I mean, you've got some blood data now. Everybody knows your story. You might as well just.
Yes, I do. I mean, a lot of that is no longer in my system. at some at the antibody level, and you know, some a lot. I mean, I haven't had symptoms of all sorts of things in a couple of years now.
So there you have it. So it's the point is that all these things that have kind of taken residence in the body, it's just a matter of time. It's just a matter of time. Elena, I'm sorry to put you on the spot. Dr. Denny, thank you for letting us take the time.
Oh, it's absolutely our pleasure. We're very excited about this. And of course, we know there's going to be a ton more questions. And again, our start date for this procedure, this analysis and procedure, will be October 4th, first thing in the morning. And when people have questions, more questions about the procedure, we will be more than happy to answer them. We always welcome complimentary consultations to go over treatment strategies for patients. And obviously, as most people are gathering from this meeting, that there's more to healing than just any one particular treatment. Everybody's unique and everybody has their own set of needs. And we're always happy to do a complimentary consultation. But you must bring us your laboratory studies or I'm going to strangle you. It's very important that we have meaningful data to look at in order to put together treatment plans, including TruDOSE, and we are really anticipating this becoming an integral part of our integrative medical model of treating people with chronic illness and disease and everything in between. And we really look forward to that. So, Tapley, we can't thank you enough for giving us your time, and Elena, your time for this. We really do appreciate it, and we look forward to that follow-up meeting, which I'm sure we'll be talking more about. And we're very excited about uh, getting this off the ground. And those patients who have been listening to me carry on about this for the last few weeks, I hope you've done your due diligence and you've looked and you've seen online more about the TruDOSE procedure and how wonderful and meaningful it's been for people. And I'm very happy that we were able to have this time with everybody to do this meeting. And yes, there will be a follow-up meeting to this, and we'll get that organized soon enough. And again, we're going to get this off the ground on October 4. Yeah.
I'll see you guys on October 4th.
Fantastic.
So much.
See you guys.
Good night, everybody.
Bye.